I just got out of work and I still have this on. I bleached it though. I brought everything with me from my locker, so I have 3 bags worth of things because I don't know if I'll be back. I'm sitting outside of the grocery store because this might be the last time I could do shopping before they completely lock our city down. This is literally what I look like after. It was a good shift. But yeah, I just found out that we have at least 1 confirmed across the hallway, and nurses are calling in sick already from that unit. Got 2 to 3 emails from the CEO basically saying to conserve supplies, going over some absence stuff. Actually, no, they didn't go over absence stuff. They said if you have questions about it, contact HR. I don't think they've figured it out yet. I ran into somebody in the elevator who told me there were at least 3 possible patients with the virus in the emergency room yesterday, and I think my unit is getting a suspected case right now as I was leaving. This shit is getting too real. I have to decide now, and my hospital is not doing a thing to protect us, and that seems to be the consensus among the nurses I worked with yesterday, and some of the random people at work that I've run into in the elevator. I just randomly asked, like, somebody from pharmacy, somebody a phlebotomist, a transporter, somebody from the cafeteria. I literally just asked them, hey, what do you think? How do you feel about this? How do you feel the hospital's been preparing for it? Do you feel like we have enough knowledge? And everyone across the board that I've spoken with so far the past week has said we haven't been prepared enough. They are keeping us in the dark. And I'm so lost. I wish we just had some kind of guidance, some kind of leadership. I feel like they're just dumbing all of this down and making sure we just don't panic. We've got our tents are set up. The ER was empty. It was a slow night for me. I got 1 admission. Funny, getting patients who have gotten injured because of panic buying. And literally we are saying and anticipating that in 2 weeks or less, our hospital is going to be filled with patients with the virus, and it's going to be a big fucking mess. We're not ready, even though leadership or management wants us to think that we are ready. We don't have hazmat suits. The N95 masks are running out. We are locking all of the masks up. I can't even get a simple mask. Correction, it's not so much that I can't get a simple mask. At this point, we have all the masks locked up. Our charge nurse has to give it to us. We have to sign our names and the reason why we are getting a mask. And email after email, they're telling us to conserve the masks for when we have the positive COVID-19 patients. So in my mind, I'm just like, let's save the mask. Even though this patient's coughing, I want to save the mask just in case we need it. And the problem is we're not testing, so I could very well have the virus already. We're not fucking testing. We're not testing enough. I was told that ER is sending some stuff out. Still not enough. It takes 2 days to get the results, so I'm not sure where they're putting these patients. Some, they're being sent home to have them quarantined. The others, they're bringing up to our units. And we are officially just putting them on droplet precautions. We don't have enough negative air pressure rooms, so we can't put people on airborne precautions. We don't have enough goggles, masks with shields. We are being told to nasal swab people. We're not even trained to do it properly. And the last I heard, even with MRS face swabs, some of us aren't doing it right. So about a year ago, they said they were going to have somebody show us how to do it. That never happened. So we could actually be swabbing these people, sending it out to the lab and getting false negatives, I think. That's just my opinion. Because if you don't get it in deep enough, it's going to be negative. Right now, from what I heard, because of the one patient confirmed, that unit is having a lot of sick calls. A lot of nurses are calling in sick. So even today, one of the nurses from my unit has floated to that unit. Good luck to her. They'll probably end up giving her that COVID-19 patient. And I understand we shouldn't be stigmatizing. It's just really scary because we're not ready. We don't have the equipment and we're not testing. The other email we got is that the hospital has stopped or postponed elective surgeries. They're putting it off for, I think the maximum right now will be about 3 months. 3 months! They're anticipating 3 months right now of just a lot of COVID-19 patients. So they're emptying out the floors and the beds. My unit we do a lot of surgeries, so they've emptied it out. And I don't really want to say where I want to say where I work, what unit I work in, but I don't really want to say it. Let's just say they're emptying out all the surgical patients, all the trauma patients, all the patients that don't really need to be there. I think I probably slipped my mouth already, but so we actually had low census. So some people think, that it's people who aren't following this, they think that we're home free, or at least for now. They just don't know that we're actually making room, and I anticipate the next few days it's just going to be a rush of all these confirmed cases. And so it's really hitting me right now. People keep telling me, even my coworkers are like, if you quit, just don't ever show up again. We totally understand. They keep telling me to protect myself first, which my gut says to do that, especially since our hospitals are not protecting us. I know as a nurse, you're a patient advocate, but it's really hard to advocate for yourself, and you just kind of want to be there to help, especially when you know it's going to be a fucking mess. At least I feel like I want to be there, and I feel bad for the people I would be leaving in that shit show. My friends, oh my God. But they don't have the health problems that I do and the asthma. I can barely catch my breath for the past 2 days. I don't know if it's anxiety or I have a fucking cough, and I don't know if it's fucking corona that I've been exposed to, or asthma, or anxiety, or what. But speaking of anxiety, got a text that we're pretty much going to be on lockdown soon in the next few days. I think they're quarantining our entire city. And when we got that, my coworker and I kind of freaked out. My coworker had a little panic attack and she started crying, and I had to tell her to chill out and take a deep breath because she had some urgent matters she had to attend to for a patient. And how do you work in this kind of situation? Like, we're going to be making mistakes. Honest to goodness, people, stay away from the fucking hospitals. We are trying to keep our shit together. Our brains are not there. We're totally consumed by the fact that we might get this, that we have no protection. It's hard for us to concentrate on what we're doing, plus the fact that we're not sleeping, because my coworker and I were talking about it last night. She's been sleeping 4 or 5 hours or less. We work graveyard a day because we wake up thinking about this and always checking the news to see what the update is in our city, in our town. All the nurses I've talked to are resigned, as am I, to the fact that we are going to get this virus. And I'm surprised to learn that some places in the United States are bashing nurses. They're giving us dirty looks. Some Airbnbs and apartments and things like that are stigmatizing, and we are being blacklisted because we're see what I mean? We're high risks. And I was warned to be careful when I go out in public with my uniform, my scrubs, because people will look at you badly and just assume that you have the virus. You are the plague. And I can see how 1,700 nurses and doctors got this virus over in China, even though they were draped head to toe in and they were wearing the hazmat suits. It's because you're so fucking exhausted. You can't go to the bathroom, you can't eat, you're dehydrated because you can't drink because you're gonna have to go to the bathroom and suit up again, and there are not enough suits, so you want to conserve it. We're not going to have those problems. The scars on the faces that some of these nurses and doctors have, we're not going to have those scars because we don't have the face protection. We have paper masks at the most, just for now. After that, it's gone. Oh, and our hospital already said that that's a waste of time. It's not going to work. Even N95s are a waste of time. It's just there for the patient's psychological safety, so that they know that you are protecting them, when in fact it is not filtering out the virus. The virus, whatever you call it, is too small. It's just gonna seep through the N95 masks and into your lungs. Anyway, yeah, so they're sending all the patients to us, or we are going to be floated to the areas with the COVID-19 patients. And I've got asthma and no protection, and I'm scared shitless, and I don't know what to do. I need health insurance because I might get it out of the community anyway, and yet I just read that it's going to be practically like an investigation. If I say that I want to be tested and I say that I need to be on leave for possible exposure, they're going to have to investigate. It's going to be, it sounds like a difficult process to navigate. To sum this all up, before I go grocery shopping, probably for the last time, although I've been saying that for the last couple of weeks, but you know, now that I know that we're really going to be shut down and may not go out, oh God, is this just a bad nightmare? I am just fucking pissed off. That is such an understatement. Livid is an understatement. I don't even have the words for it. That the government dropped the ball. They did not start testing. They did not, they weren't on top of this. The CDC, who all the hospitals are following, dropped the ball. The hospital administrators, who knew that this was happening in China, in Wuhan, had 2 months to prepare, and they did nothing for the healthcare workers. I tried to prepare myself as much as possible since December. They say knowledge is power, but fuck that. I don't know if that's really even true, because no matter how much I tried to prepare myself, because work didn't prepare us, we are being thrown out there to the wolves. No protection. I don't know how to protect myself. We have no fucking union. Some of the union hospitals right now are they're going on strike, trying to get more masks for the workers. Masks that are expired, by the way. I found out that a lot of the masks, N95 masks in California, are expired, but we're being told to use them anyway. They said, go ahead, you can use them, and you can also use a surgical mask, because these are just droplet. They're calling this droplet precaution patients, even though some say it's airborne, and that's because we don't have enough masks, so they want us to feel better. And now I gotta call my doctor, call HR. I need to figure out how we're gonna protect people like me who has asthma, and I don't know. You know what? I'm just fucked. It's been nice knowing you guys. Nice chatting with you. Please stay at home so our jobs are not just wasted, and our lives are not just wasted. Please just fucking stay home, and I hope something changes after this. This is fucking ridiculous. No rights for healthcare workers. No protection. We're being told to risk our lives and make the patients feel safe, even though they're not. False sense of hope everywhere. And yet that is the job of a nurse. You stay calm and you put on a front and pretend that everything's fine, even though you know in the background everything is going to hell, and reassure patients and the community not to panic. We are fucked. Like, royally fucked. Take care. Godspeed. Nice knowing you. It's been fun. Bye.